With respect to pregnancy, if you start your pregnancy with specific risk factors, you are at higher risk of developing high blood pressure or diabetes in pregnancy. So if you are a woman, above 30 or 35, and definitely above 40 and conceiving a baby, you are at higher risk of developing diabetes or high blood pressure. If you have a family history of high blood pressure, or your sister had diabetes in pregnancy or high blood pressure in pregnancy, you are also at higher risk. And if your BMI is elevated as well, again, you are at higher risk of diabetes and hypertension in pregnancy, which can complicate your pregnancy. But more importantly, it actually does increase your risk of developing diabetes later on in life, or maybe high blood pressure later on in life. So these are cardiovascular risk factors that occur in pregnancy that after the baby's out, we're like, oh, this was just in my pregnancy. I don't need to worry about this. But the reality is that having these diagnoses actually is sort of like a preamble or a premonition of what you may be at risk for later on in life. So don't take this lightly, and make sure that you do follow up with your family doctor about, if you had these diagnoses, what this means for you in your future health, both perimenopause and menopause and beyond. And the other thing that is not often on the radar, but if you've given birth prematurely, or if you have low birth weight child, so a baby that's under the cutoff 10th percentile at birth, those are also cardiovascular risk factors. Why that is the case is because we know the placenta is an organ, and it's functioning to provide nutrition and oxygen to your baby. So if your placenta is not functioning, there's something going on with the flow of blood to your placenta. There's some sort of resistance in the placenta. And if that organ, which is the placenta, is having resistance, then there's a likelihood that's probably happening in other organ systems as well. So it's sort of like another premonition that you may have some issues with the way your vasculature is working, because if your baby's not getting enough oxygen because your placenta is not working, it's all actually very connected. And so being aware of these things that happen in your pregnancy can actually help you and your family doctor to determine whether you need to start screening earlier on later in life, or whether this might be a symptom or a signal that there could be things that are potentially going to increase your cardiovascular risk as you get older.